Welcome back, my good people, and in today's video we are going to talk about pre-exposure prophylaxis, that is PrEP, the antiretroviral drugs that we are using when we want to prevent HIV. And in this topic we are going to look at eligibility of PrEP, those who are at risk, those who should be given or those who should be issued with PrEP, and we are going to look at the specific antiretroviral drugs that we are using in this pre-exposure prophylaxis, and we are going to answer the most commonly asked question, that is there possibilities that I can seroconvert, that is I can turn HIV positive while I'm in PrEP. If you love this channel, kindly click the notification bell, rate and subscribe, turn it on for more videos that I will post. And for my loyal returning subscribers who have clicked this video again, thank you so much, and kindly leave a comment in this video. Now let's do it. Now, pre-exposure prophylaxis, that is PrEP. This is antiretroviral drugs that we normally issue so that we can prevent you from acquiring HIV, which can really develop to what we call now AIDS. Before we consider you for this particular drug, there are some key components that we should be able to follow. So these are the criteria for PrEP eligibility. Now, when we have done HIV tests and we have confirmed that you are HIV negative, leave alone self-test. Self-test is not a criteria for initiation of PrEP. But if you come to the hospital, we must do according to HIV testing counseling algorithm. When we test you and we find that you are HIV negative, then you are eligible for this particular PrEP. We can give you this particular drug and it will really help you. Number two, when you are willing, when you are willing to take the drug, we can counsel you, we test you are HIV negative, and we tell you that if you are sexually active, you are constantly involving into sex, but you are not willing to take this drug, then there is no way we are going to issue this drug to you, because it will not help you. When you do not have the recent or recurrent infection that might depict that you are having HIV, those flu-like symptoms, that's heavy stuffing of the nose, fever, muscle pain, those are the signs of acute infection. If you do not have those signs in the past 1 month, then you are really eligible for this particular drug. When you have no contraindication for the drugs that we use in PrEP, then you can be eligible for this. And this one we are going to consider the renal functions and even the liver function test. When you do not have any renal disease or liver disease, then you can be very eligible for this. Then gender-based violence screening and intimate partner violence screening is very important, because we cannot give you a pre-exposure prophylactic drug and then your spouse is not willing for you to use this particular drug. GBV can ensue and it can really affect your adherence of this particular drug. So if we have screened you and we are very sure that there's no gender-based violence and even intimate partner violence, then you are very eligible for this particular drug. Of course, also we'll do what we call mental assessment, and we'll be sure that you are mentally stable and you can adhere to this particular drug. Then you are very eligible for this particular test. Now, what are the drugs that we use for this particular PrEP? I'm going to leave a video that is running concurrently with this video I'm making, just to show you the pictorial nature or the video nature of those drugs that we normally use. Now, we have what we call daily oral PrEP, the one you normally take daily, that is tenofovir and emtricitabine. Emtricitabine and tenofovir fixed dose combination. The video is appearing somewhere here, and you can look keenly at this drug so that you might be aware of TDF, that is tenofovir, and FTC, that is emtricitabine. So you just check out those videos and you will be well conversant to it. And again, we have event-driven oral PrEP, that is tenofovir and emtricitabine or tenofovir plus lamivudine. And tenofovir plus lamivudine, you can look at the drug. It is appearing somewhere here in the video. Look keenly at that particular drug and you should be able to know about how those drugs look like. Now let's go to how are we going to take the daily oral PrEP and event-driven PrEP. Daily oral PrEP, we take this particular drug 7 days daily. And when we take these drugs daily for the 7 days, we are going to achieve the peak plasma levels and then the efficacy of this particular drug. So it will really help you when you are taking this particular drug. It will really prevent you from getting HIV. In fact, it is documented that it is 99% effective when you adhere to this particular drug, and when there is no contraindication of this particular drug, when you take it for a period of 7 days, majorly if you are a female, it is very, very important in that scenario. In men, there is it's documented that between 2 hours to 24 hours, then the efficacy can be achieved between the period of 2 hours to 24 hours, but the ideal is 7 days. So basically the general advice that we normally give is that when you are taking PrEP, the daily oral PrEP that you are taking daily, then you should be able to take it from day 1 to day 7 is when you involve yourself in sex, even without protection. But before those particular time, the number of days achieved, you can use protection, that is condom. Now event-driven sexual intercourse is that this is now the time that you want to involve yourself in sexual intercourse, but you are not taking the oral daily pill, in that you did not prepare for this particular sex, but you really want to do it. So you take the event-driven oral. In event-driven oral PrEP, we use both TDF and FTC and TDF plus 3TC, in that we use a formula of 2-1-1. When you are anticipating for sexual intercourse and you are not taking oral daily PrEP, then the formula 2-1-1 is very, very important to you, in that between 2 to 24 hours you take 2 pills. Then you have your intercourse, then after 24 hours you take another 1 pill, and then after another 24 hours you take another 1 pill. So meaning you are going to take 2 pills now, then after 24 hours another 1 pill, and another 24 hours another 1 pill. So that is why we use a formula of 2-1-1. The government is really working hard, and recently they have rolled out the vaginal ring that contain ART, and we call this one the PIV ring. The PIV ring is available in some selected facilities, 25 milligrams inserted vaginally, and it releases the antiretroviral PrEP slowly, and this normally help in HIV prevention. Injectables is currently under study, and we have what we call cobatagravir. Cobatagravir is an injection that is given 600 milligrams IM in 2 doses 1 month apart, and then repeated 600 milligrams every 2 months. This one is still under study and it has not been rolled out yet. Which particular people are contraindicated for this particular PrEP? Now, when we suspect HIV infection, those flu-like symptoms, then we might not give you HIV PrEP until we confirm that you are HIV negative. And when you are not able to adhere, when you are not able to take these oral drugs, when you are less than 30 kgs and less than 15 years, then it is contraindicated for you. When you have impaired renal function and liver functions, then you might not benefit from this particular drug. Now, the commonly asked question that what happens when you seroconvert or when you turn HIV positive when you are using this particular drug? What might be the cause? Number one cause is adherence. Adherence. If we give you this pill, you must take it. If you are not taking it, then you might turn HIV positive. And when you have been exposed to some numbers of virus which are resistant to ART, then you might seroconvert, you might turn HIV positive because of the mutation that has taken place now that the HIV is resistant to the PrEP you are taking. Psychological factors, poverty plus gender-based violence and intimate partner violence may also affect adherence. And when adherence is affected, then you will not be able to adhere or take these drugs daily or as indicated, and this might interfere with your taking of this particular drug. Now, if you are not able, if you have not seen how ARVs look like, then this is the video for you. Kindly watch this video, click it and watch it. You will see how those drugs look like and you will be well conversant with. Otherwise, if you have not subscribed to this channel, click this notification bell written subscribe, turn it on for more videos that we'll post.